I'm Abby. I'm going to be doing my Trach Care skill. So I'm going to ensure that I have all my supplies before we get started. I have my sterile kit here. I have my clean gloves. I have my peroxide and my saline, but I don't have either today, so I'm just going to use this, which they are both unopened, so I'm just going to leave that there. I'm also going to ensure that I have the appropriate PPE based on my facilities policy, so I may need a face mask and a face shield. So I'd ensure I would have those supplies also. So I'm going to check to see if I have an order, which I'm going to pull up in the MAR here to see if I have a order for that, and we got it. So I got the order, and I'm going to go in the patient's room. So knock, knock, knock. Mrs. Bright, can I come in? Hi there, Very Bright. My name's Abby, and I'm going to be your nurse today, and I am going to be doing some trach cares. So can you tell me your name and date of birth, please? Okay, and do you have any allergies? Perfect. So I'm going to just verify that, and she said Very Bright, date of birth 10/12/93, and allergy to penicillin, which that is there. Okay, so I'm also going to wash my hands, provide privacy, ensure that the patient is in a comfortable position, but also within working height for me, and I'm going to make sure the bed is locked, and we're gonna get started. So I'm going to do a quick assessment here, which is going to assess the need for suctioning before we do the cares. So I am going to take a quick listen to the breath sounds, and so I'm going to listen to the lungs here. Okay, everything sounds clear, but I'd be listening for adventitious breath sounds here, and everything's good. So I'm also going to take a feel for the pulse, and I'm going to monitor respirations and look for cyanosis, also oxygen saturation, as well as seeing what the patient's level of consciousness is and seeing if there's any changes in behavior like restlessness. So now that that is all good, I'm going to put on some clean gloves and take out the fenestrated dressing. So I have my clean gloves here, and I would have washed my hands before I put my gloves on. So wash my hands, and I got my clean gloves. Bear with me, they're a little tight, but got them on here. Okay, so now I'm going to remove the oxygen here, and well, I would be doing this while I'm taking out the dressing. So I'm going to take out the dressing under the trach here and putting it in my hand, and then I'm going to replace the oxygen back on. And while this dressing is in my hand, I'm going to be assessing for secretions. I want to note the amount, the consistency, color, and odor. Okay, so now that I did that, I'm going to wrap it in my hand, and then I'm going to discard. So I'll wrap it up, and I'm going to throw it out. So that is done. I'm going to additionally wash my hands here, and I'm going to start setting up my sterile field. So I have my sterile kit here, and I'm going to open it away from me. So I'm just opening it away. And then the first thing is I'm going to take out my sterile gloves. So I'm going to take out my sterile gloves, put them to the side. Stepping away. Okay, so I have my sterile gloves on, and I'm going to get rid of this to maintain my sterile field here. And then now I'm going to get out my drape. So I'm going to take out my drape and open it up, and I want the shiny side down. So I laid that, and now I'm going to take out all my supplies. So I'm going to try to not contaminate my sterile field. Step around, toss my things on here. Okay, so now that that is all on my field, I'm going to open my saline, and I'm going to dump it in the compartments. So I'm going to use my clean hand, and I'm going to grab it. So I'm going to go around my sterile field and open this here, and I'm going to pour my saline in the compartments. So I left a couple Q-tips in there that I didn't see, but they're already sterile, so I'm just gonna leave them in there. So set that to the side. So now I am going to take out the inner cannula, and we're gonna clean. So I'm gonna come around because I wanna try to maintain my sterile field with the setup I have here, and I'm gonna go around here, and I am going to take off the oxygen with my clean hand. Oh shoot. Bear with me, the setup, it's a little tight, so I'm just trying my best here. Okay, so, and I'm just gonna grab the top here. So if I would have done that in the clinical setting, I would have obviously wanted to reposition my patient better, but for the sake of the video, I'm gonna drop it in here, and I just wanna make sure I was touching just the top part. And now with my sterile hand, I'm going to grab my brush so I can get it clean. Okay, so I'm just gonna grab my brush here, and now I can hold the top part of my inner cannula, and then I can scrub. So I'm going to scrub in the inside, and I will also scrub on the outside. So within this compartment, I would have also ensured that there was 50% hydrogen peroxide in there. And so now that I clean, that's good. And then I'm going to rinse it off in this compartment that's just saline to ensure that all the peroxide came off. So now that I did that, I'm just gonna still grab the top part, and I'm going to knock it off the side so that I can keep it dry. And I also would have ensured that the patient had the oxygen back on. I would have replaced this back when I was doing this. So now that this part is done, I'm going to put this back in. And now the sterile part of this procedure is over, okay? So when I'm cleaning now, I'm going to make sure that the oxygen is back on. Okay, so now that that's good, I'm going to clean the outer parts of the trach. And so I have these Q-tips, and I'm gonna use my last compartment here. I'm going to moisten it in the saline, and I'm going to clean as best as I can around the trach site, and then discard. And then I'm also gonna grab another one here and do the other side. I could use as many as I would need to ensure that the site was clean, but then I'm going to clean on that side as well. So I have some additional gauze here, and I could use that to clean the faceplate of the trach as well as the inside of the oxygen if there was a buildup in secretions and things like that. So now I am going to replace the fenestrated dressing. So I'm going to do that now, and I'm just gonna stand aside to get a better view here. And I'm going to stick this underneath as best as I can, making sure it's not bunched up here. Okay. My patient doesn't have a very good neck access, so I'm doing the best I can with that, but I would ensure that it was flat and everything was good. So now I need to replace the ties around the trach, and I would do this by replacing them without taking the old strings off. So I'm going to do that now. Bear with me. This procedure might additionally need another person, but now that I have the ties in securely, I'm going to now remove the old ones, still wanting to ensure that I keep everything tight so that the trach does not become dislodged. So I'm going to remove the old ties, ensuring that that is placed. Okay, so now I'm going to discard my supplies. I'm going to keep them decent for additional use purposes, but I would discard of everything. And now I'm going to do an additional assessment to see if there's more need for suction at this point. I'm going to take another listen to the breath sounds. Listening to the lungs. Okay, I would do my oxygen saturation, feel for the pulse. I would monitor for signs of cyanosis and see if there's any change in the condition, so restlessness, things like that. Then I'm going to take off my gloves and provide hand hygiene. So I'm going to do that and also make sure that the patient is doing okay. If anything were to be abnormal within the assessment, I could do suctioning at this point. So that's why we did the assessment. So everything is good here. I washed my hands once the procedure was over, make sure the patient tolerated it well, and now I would go back and document. So I'd want to document to ensure that my, again, patient tolerated. I'd want to note the color, consistency, odor, and amount of the drainage from the dressing, also noting the size of the trach and everything like that. So that completes my skills. Thank you.